Baltimore's Big Morning Show with Ed Norris and Jerry Coleman, and also me, Rob Long. This here is Dr. Todd Melegari. He is orthopedic surgeon at GBMC, where you've been for 2 years now, am I right?
Correct.
Now you have a journey of how you got here. We were talking before we came on live, and you started off before here in a private practice and well-educated. Tell us a little bit about your background.
So I grew up in Pittsburgh. I did my undergraduate work at the University of Virginia. Then I went to medical school in Philadelphia at Drexel. After that, I did my general orthopedic residency training in New Jersey, and then ended up doing what's called a fellowship, which is an additional year of subspecialty training in sports medicine, actually here in Baltimore at Union Memorial. After that, I took a job up in Pennsylvania and worked there for a while, and then the opportunity came up at GBMC, so I decided to come back to Baltimore.
Well, your resume started off very impressively because UVA and Drexel, those aren't two schools that, just take any students. So you had to go through the entire gauntlet to be where you are today, am I right?
Yeah, I mean, anytime you wanted to get into medicine, there's definitely some competition, so you have to kind of be on top of things, and I was real fortunate to be able to attend those universities and get a good education.
GBMC, you've been there for 2 years, orthopedic surgeon. What exactly do you specialize in, or what's the most common injuries that you see?
So at GBMC, I would consider myself basically a general orthopedist. In other words, I see kind of all kinds of different things, from kids all the way up through elderly folks. As I had said before, I did a sports medicine fellowship, so that's kind of my area of interest, my area of focus. That ends up being mostly knee and shoulder injuries, but like I said, I see a little bit of everything, including fractures, and just try to take care of the community. I think GBMC does a great job of doing that, and so I feel like our role in the orthopedic department is to basically take care of the community needs.
Now we're going to be here. You can send us questions right here on this Facebook live page, and we will get it to Dr. Melegari. Now, before we open up to the questions, I have one.
Sure.
One in particular. You hear from doctors, or I should say people who aren't doctors all the time, coaches and people who try to be part of the medical staff, ice, and you hear heat. When should you apply ice, and when should you apply heat to injuries?
Sure, that's a great question, and a question that we get all the time. And, I would preface the answer by saying, in general, I don't think you can honestly go wrong with either one. You're not going to do any harm or damage. But there are some specifics. When you're dealing with an injury, an acute injury, you're playing a sport or you're doing whatever and something happens, usually that's when ice is certainly the way to go. What ice does is it basically constricts blood vessels and therefore diminishes swelling in the situation where you have an acute injury. I tend to lean people towards heat for the more chronic injuries, especially warm-ups and things of that nature, because that will stretch out the muscles and potentially help diminish an injury. But for chronic conditions, I always tell my patients, I say, these are my recommendations, but if you try either heat or ice and you find it not very helpful, and you try the opposite alternative and you find it to be helpful, then stick with what helps you. But I'd say for sure in an acute situation where you have an injury, ice is the way to go.
Now, doctor, I'm a coach. I coached college ball, now I coach high school ball. How much does overuse come into play? Because nowadays kids are training 12 months a year. They have trainers, they're working out. I know in basketball you have AAU, you have high school, you have fall ball. How much does overuse come into play with some of the injuries nowadays?
I mean, overuse is huge. There's been a major change in the way that people approach youth sports. When I grew up, when you grew up, you kind of did a little bit of everything. Summer was baseball season, fall was football season, winter was basketball. And we come to the point where people focus on one particular sport very early on, and those individuals, those kids, like you said, will be playing fall ball, they'll be playing baseball year round. And what we found is there's definitely been an uptick in overuse injuries. Baseball in particular, shoulders and elbows. We see a lot of younger and younger people injuring ligaments, especially in the elbow. You probably hear a lot about
Tommy John.
Yeah, I was going to say Tommy John in the professional population, but it's trickling down to the younger folks, and I don't think there's any question it's all about overuse. So, you know, we advocate being smart about it, taking periods of time off, you know, if possible, trying to vary things up, because each different sport uses different muscle groups and puts stresses on different joints, and by rotating things throughout the year, you're much less likely to end up with a problem.
Yeah, that's a great point. So it's not about a matter of taking the time off and not doing anything. It's about doing multiple things.
Yeah, absolutely. That, like I said, you'll work out all the different joints, and basically working in one sport will theoretically protect you from injuries that you might have in another sport.
It's like a version of cross training. It's almost, if you play multiple sports, it's almost like cross training.
Yeah, absolutely.
So now you just gave me an excuse. So now, if my wife is watching, when you ask why I signed up to all the adult leagues, Dr. Melegari says, it's not me signing up to the leagues, it's cross-training. So when I want to play flag football and softball. Thank you very much, Dr.
Sure,
you solved an argument in the Long household. But then again, I don't ever win arguments in the Long household. Here's a question we have in right now. I suffer with severe shoulder and neck and arm pain. What is the best thing for me to do?
So the question actually brings up an interesting concept. A lot of times I see folks in the office and they come in and they say, you know, I'm here about my shoulder. And it turns out they have a little bit of discomfort in their neck, and there is pain in their shoulder, but that pain, you know, extends all the way down their arm. And most of the time in that situation, it's really not the shoulder that's the problem. It's actually a problem that's being generated in the neck. The most common thing in that scenario would be some type of nerve root irritation or pinched nerve. So I think that's the key in trying to figure out what would be the best thing for that individual to do, is kind of nailing it down. Where's this pain really coming from? And I think the best way to do that, in all honesty, is to get evaluated by a physician and an orthopedist, because you don't want to start treating one thing when in reality the pain and problem might be coming from something else. And even when I see people for the first time, sometimes it's not clear cut, and you know, doing different tests, whether it's X-rays or different imaging studies or trialing treatment. Sometimes we have to do those things before we really know for sure. So I think in that situation where it's not clear where it's coming from, it's probably worth a trip to the doctor.
Yeah, I mean, MRIs come into play with that as well?
Yeah, sure. I mean, an MRI is honestly not usually the first test that we order, but depending on the situation, it certainly might be something we have to consider. I mean, a lot of times people do come in and think an MRI is going to answer all the questions, and oftentimes it's very helpful, but like I said, it's typically not the first thing we do, because a lot of times we can figure things out without it, but you know, in situations where there's questions, it can be a very important part of the workup.
Now, that brings about a question for me. I kind of know this, but more technical version of it. What's the difference between an X-ray and an MRI, and what different information do you find from either?
So, you know, just in broad terms, what an X-ray does is it shows us the bones and the joints. Okay. The big difference with an MRI is it's going to show us the soft tissue structures, muscles, ligaments, nerves, and different things like that. So that's another interesting question that you have, because a lot of times people will come in and they'll have had an MRI done, and you know, will recommend getting an X-ray, and they'll think that, well, we already had an MRI, why do we need to get an X-ray? And they are very different tests, and they can give us kind of a more complete picture of what's going on and give us the best chance to, you know, figure out what the problem is.
Now, baseball, you talked about kids playing baseball. Some a lot now playing year-round baseball. Here's a question. And my son sometimes complains of shoulder pain after a long baseball game. What should I do for him? And again, it goes back to what I asked you. Is it ice or is it heat that's best for him?
Yeah, I think in that situation I would, for starters, for sure start out with ice, because you know, you're kind of talking about possibly an acute injury or even some overuse, and again, like we said earlier, the ice can cut down on the blood supply and limit the swelling and ultimately hopefully limit the pain. And I think the key thing there is, you know, in that situation, is it something that, you know, there's pain after every game, or is it something that the pain comes and goes? Does the pain get better with relative rest? Because, you know, if the answer is no, if there's pain after every performance, after every game, I think it probably would make sense to be evaluated to see if there's something there, to make sure you're not doing, you know, additional harm or damage. But, you know, the short answer to the question for that situation, I definitely do the ice.
Now you talked about that, some normal pain, and looking at some of the activities that's done right now in baseball and basketball, what type of pain, or I should say more discomfort, is normal after sporting events?
Yeah, I mean, I think in general, if you address the pain, try to treat it in a simple fashion, things like ice, or anti-inflammatory medication. If you do those things and the pain persists, that's kind of a red flag. You know, that means, well, maybe there's more going on here. Because usually if it's a little bit of overuse, which is generally not harmful, it should get better. It should get better if you try ice. It should get better if you try anti-inflammatory medications, things like ibuprofen and Aleve. And again, if things just aren't getting better despite giving it an honest effort, and part of that effort, honestly, is rest. I mean, if you're having lots of discomfort, I know everybody's very active and kids are, you know, chomping at the bit to get on the field, but at the end of the day, giving it a little time away is a good test to see, well, is this something that really needs to be checked out?
We're on Facebook Live right now from the CBS Up Close Performance Studios. I'm Rob Long here with Dr. Todd Melegari. He is an orthopedic surgeon at GBMC, where he's been for 2 years. Now, doctor, it's middle of the day. A lot of people watching right now on Facebook Live are probably not in school, of age to be in school. They're people like me, the weekend warriors. And you're talking about a lot of the pain and injuries that we have right now. Let's say you're 30 plus, or in my case, and I know it's hard to believe, 40 plus, you know, and you're playing in leagues and you're playing weekly and sometimes twice a week. What kind of preventive maintenance do you suggest for us?
I mean, I think it's just all about moderation. I mean, if you're playing different sports, if you're involved in different leagues, I mean, theoretically those leagues probably run for a certain time period. And what you want to do is, even in the off time, you want to maintain some general exercises, flexibility and strengthening, so that when you go from a situation of not being overly active to getting involved in a league, that your body doesn't, you know, catch up with you. And if you keep things mobile and strong and while you're in the off season, then when you jump into a full season where things might be a little more intense, I think you're much less likely to run into any problems. So it's just about, you know, keeping a balance, and then, you know, once you start, you're ready to get involved.
I'll give you one. Tendonitis, meniscus area, right beneath the knee. What do you do for that? You've had the X-ray, you had the MRI, doesn't detect any tears. Is that just a matter of getting proper rest in between activity? Yeah,
I mean, honestly, pain in the knee, especially in the front of the knee, the anterior part of the knee, that's probably the most common thing that I see. And by and large, it has to do with the way that your kneecap works. And the best thing to address that situation, assuming there's no tears or anything, is strengthening the muscles on the top of your thigh.
And that's what I was going to ask you. So weight training and things like that help out a lot.
Absolutely. On top of your thigh, there's 4 muscles. We group them together and we call them the quad. And those muscles basically direct your kneecap. They guide your kneecap when your knee bends and the kneecap goes back and forth. And by strengthening the muscles, you can make sure that the mechanics there are optimal, and you can diminish the pressure on the kneecap, and ultimately, by doing so, hopefully diminish the pain that you have, to the point where you don't have any pain.
Now, Weekend Warriors doesn't even isolate you just playing ball, and I don't want to be exclusive to those people. You talk about preventive maintenance, we just did that. So here's another question. Are there certain shoulder exercises that I should be doing before exercising, or quite frankly, just working in the garden?
Yeah, I don't think it's a bad idea at all. By doing, you know, a daily maintenance exercise program, there's really, in my mind, nothing negative that can come from that. In terms of specifics, I would direct folks to a website, the Academy of Orthopedic Surgeons. It's aaos.org. There are several different attachments there where people can get a good explanation of what exercises are appropriate. You know, I just caution people about just going on the internet and just searching in general. There's a lot of good information there, but sometimes you don't know where it's coming from. And if you go to a website like the one I had mentioned, you know that you're going to get the right kinds of things. And it's going to basically be exercises that involve a combination of stretching and strengthening. And there's diagrams on there because sometimes it's hard to, you know, explain things without some type of visual prop. So I would, like I said, highly encourage folks to check that out and get a good exercise program. And, you know, the other option is, you know, visiting a physical therapist. Physical therapists are well-trained folks. They've got tremendous knowledge base, and you know, a lot of people think, well, if I go to therapy, that means I'm going to be committed to going, you know, 2 or 3 times a week for several weeks, and that's not the case at all. If your sole goal is to learn a home exercise program, therapists would be happy to see you once or twice and teach you that stuff and then get you pointed in the right direction. So that's always another option too.
And this is a question from Allie. She wants to know, are there any steps you can take to avoid experiencing pinched nerves?
Typically, pinched nerves are hard things to avoid. A lot of times, pinched nerves are a result of some type of trauma, but generally you are likely to have some type of pre-existing issue. The nerves generally get pinched where they branch off your spinal cord, and they can get pinched because the tunnels that they travel through are narrow, and that's just oftentimes congenital. In other words, the size of the tunnels is based on the way that you're put together. They can also be pinched by discs that herniate, and in general, you can't necessarily prevent a disc herniation, but what you can do is you can strengthen the muscles around your neck, right. And that can generally take pressure off those areas. So again, that would be the thing that you could do, and unfortunately it's not 100% foolproof, but that would be the direction I would suggest.
Here with Dr. Todd Melegari. He is orthopedic surgeon at GBMC. We're here on Facebook Live talking about the weekend warriors and also some of the high school and college athletes. Now, you know how it is. You're a college athlete. You're used to being around the guys in the weight room, and you're grunting and you're sweating and you're slamming weights all over the place. When does it get to the point where you need to think maybe peel back a little bit on the heavy lifting and just lift to maintain and tighten up?
I mean, I think it's all about balance. I think you need to basically be involved in a kind of a regular strengthening program, and you need to have kind of a baseline, and you need to basically work on that program a certain number of days a week. And if you want to push it on other days of the week, and young active people, college age people should honestly be able to tolerate doing that. And I think again, the one warning sign would be if you're doing it and you're causing pain, and then that would probably be a good time to sit back and say, well, maybe I'm pushing it a little too hard, and so I'd use that as a guide.
Here's one from Mel. Is it true that once you dislocate your shoulder, you are more prone to dislocate it again and again? How can you avoid re-dislocating it?
So yeah, that's absolutely true. When we're talking about shoulder dislocations, we kind of group it into 2 categories based on age. If you dislocate your shoulder and you're young, and we'll say for this discussion under 40, okay, the younger you are, the more likely you are to have a problem dislocating that shoulder again. Now, we contrast that to the older population, and when they dislocate a shoulder, it's not that common to have a redislocation. They're actually much more likely to have caused a problem with their rotator cuff. Now, once you have a dislocation, what to do to try to prevent it from dislocating again? For sure, the thing to do would be strengthening the rotator cuff. There's several mechanisms our body has for keeping the shoulder in the joint. And one of those is the rotator cuff. The rotator cuff is a group of 4 muscles, and they're what we call dynamic stabilizers. In other words, they act through their contractions to keep the ball in the socket. So once you have a dislocation, if there's one thing that you can do to try to help prevent it from happening again, that would be strengthening those muscles. Again, unfortunately, that's not a foolproof plan, but that would certainly be the thing that you would want to concentrate on.
By the way, Mary Ellen checked in. She said you recently took care of her knee.
Okay.
So you have some of your patients checking in on Facebook Live also. We're talking about some shoulder injuries. What's the most common shoulder injury out there?
The most common thing people run into problems with in my practice is the rotator cuff. Like we said, the rotator cuff is a group of 4 muscles. They come from your shoulder blade and then attach to the top of your humerus, which is your arm bone. And they basically help with rotation and movement. And unfortunately, the rotator cuff is in a situation where it's surrounded by bones, and ultimately it can get pinched over time and slowly, attritionally tear. I mean, people can also tear the rotator cuff from traumatic one-time injuries, but it's very common for it to just wear out over time, and so then people ultimately develop pain up on the side of the arm, and then that can impact everyday simple activities, things like sleeping or putting clothes on, and that's generally what prompts them to go to the doctor. But for sure, in terms of shoulders, that's the most common thing that people run into problems with.
Here's another question from Facebook Live. 60 years old, doing high-intensity workouts, shoulders hurt doing push-ups and planks, also shoulders rolled inward, have to constantly roll shoulders back. What can I do?
I think in that situation, first of all, kudos to that individual for doing high intensity stuff at the age of 60.
Yeah.
I mean, our population is aging. People are paying more attention to their health and living longer, and certainly, you know, at that age, it's reasonable to be active. You know, I think the key is figuring out, again, is there something going on that's problematic that needs to be fixed? And, you know, I think a evaluation by a physician would probably be warranted. In a situation where the patient feels like the shoulders are rolling out, what's probably happening is, or rolling in, is probably what happens is the shoulder blades tend to protract or rotate, and that's due to relative muscle imbalance. And typically that can, again, be overcome by an appropriate strengthening program.
Yeah, I mean, and that's shoulders. Yeah, you're right. A common injury. Someone asked a little bit earlier about constantly redislocating your shoulders. One of the things that I experience on the coaching side is kids who constantly sprain the same ankle over and over. Is that because it hadn't fully healed, or is it like the shoulder injury is more susceptible to re-spraining it?
Yeah, I mean, in terms of the ankle, I mean, typically a sprain is from an inversion type injury where the foot kind of rolls under the ankle. And when that happens, the most common structure injured is a ligament on the outside of the ankle. Generally speaking, that ligament has a good ability to heal itself, and most of the time with appropriate rest and rehab, people can do just fine. Now, if you run into a situation where you're continually rolling that ankle or re-spraining it, especially if it's happening in situations that are not high energy, if it's just, you know, walking down the sidewalk, or, you know, a little bit of an uneven surface and it's giving you problems, then you might be in a situation where that ligament has actually stretched to the point where it's just not doing its job anymore. And those are rare instances, but those are instances where surgical reconstruction might be something you'd have to consider.
Growing up, I used to always tape my ankles, tape them before every game, tape them before every practice. Nowadays, they have these high-tech braces that you buy. And what do you recommend more, if either, the tape or the braces that you buy in the store?
I mean, I think honestly, I think either one is fine. I mean, I don't think you need to break the bank on a special kind of brace, and I think taping is something that's very effective. Yeah. And I think, you know, we've got tons of well-trained athletic trainers out there who know how to do that, and I think that's probably the most reasonable thing to do. Like I said, bracing can be very effective too, but I think the taping can do just as good of a job. And I think I'd start with that. And, you know, like I said, if somebody's having more kind of chronic problems, then, you know, consideration for a brace at that point might be more warranted.
And I'm glad you said that you think taping is effective, because there's some people out there, you know, sometimes, you know, people think athletes shouldn't get hurt, athletes should. Medically speaking, why do you, as an orthopedic surgeon, think that taping is an effective way of preventing
I think it's
injuries?
it's kind of the tried and true method that's been around for the longest time. And, you know, the reality of it is people are still going to get hurt. You know, a lot of the sports that we do, take, you know, football, for example. I mean, that's a very kind of high impact, unnatural thing for people to do. And unfortunately, because of that, people are prone to get injury, and you can be, you know, in the best shape of your life. You can, you know, be as prepared as you want to be. You can, you know, be appropriately taped and all that kind of stuff. And unfortunately, you know, because of the stresses that you're putting on your body, I mean, you can still end up getting hurt. But like I said, you can prepare and try to limit that chance. But at the end of the day, it's still, unfortunately, something that can happen.
Now, Kim asked, she wants to go back to something you said a little bit earlier. You said rotator cuff injuries are common, very common. What are some of the treatment options for torn rotator cuff?
So I think a lot of it has to do with the type of tear. When we use the term rotator cuff tear, that's a very broad term. It can mean, you know, some degenerative partial tearing, or sometimes the muscle can come completely detached from the bone. So it really depends on what the situation is. But I would say in general, rotator cuff injuries and tears are very similar to many of the other things we treat in orthopedics, and a lot of times they don't necessarily need to be fixed. And it comes down to things that will calm down inflammation associated with the tear, and that's things like anti-inflammatory medication, or ice, or heat. Sometimes we use cortisone injections. They oftentimes do a very good job. And then it's a question of, can we build up the strength of the other surrounding structures? Like we said, the rotator cuff is 4 muscles. In general, it's unusual to have them all be torn at the same time. It's usually 1 or 2. And oftentimes, by strengthening the other ones around it and some of the larger muscle groups, you can take some pressure off that area and really minimize the pain. In a situation where that doesn't work and you have an appropriate size tear, then unfortunately sometimes you just need to get it fixed.
We're here at the CBS Up Close Performance Studio. I'm Rob Long from 105.7 The Fan. This is Dr. Todd Melegari from GBMC. He is an orthopedic surgeon. I'm just curious about how many surgeries do you perform per month?
You know, it's pretty variable. I mean, as a person practicing community orthopedics at a general hospital, a lot of it has to do with weather. I mean, some of the busiest times can be during the winter when we have snow and ice and people falling, breaking ankles, breaking wrists, breaking hips, and that kind of stuff. So, in terms of volume, it can vary anywhere, per month, from 15 to 20 up to closer to 40. And, everybody's practice is a little different in orthopedics. So, but I'd say that's probably the ballpark.
Now, sports medicine, family practice. When I was in high school and in college, my coaches always say, don't go to your family doctor for an injury. Go to a sports medicine doctor. What's the difference? Why?
So, family docs they do everything. They're folks that take care of colds, they take care of more serious illnesses, but then, they can also take care of sprains and strains. So, I think a lot of it has to do with your primary care doctor and, their level of expertise and comfort with dealing in musculoskeletal injuries. The thing about an orthopedist is, we did a 5-year training program, and all we concentrated on was orthopedic injuries, things with bones, muscles, and joints. So, based on that training, we're going to have a pretty focused knowledge of certain of those issues. So, sometimes a primary care doctor, a family doctor can know exactly what's going on and give the patient great advice. Sometimes if it's a little more complicated, then it just might be a little bit out of their area of expertise. So that's, I think a lot of it depends on the situation and the folks involved. But like I said, those of us in orthopedics just have the history of having the training and therefore are more likely to be able to get to the bottom of it the quickest.
Yeah, it's just you specialize in something.
Yeah.
You know what you know what you don't know.
Yeah.
One last question before we got out of here. Carol asked, what could be done to prevent frozen shoulder?
So frozen shoulder is actually a very interesting disorder. Basically what happens is the capsular tissue that surrounds the ball and socket gets inflamed, and then it basically shrinks. And so the patient ends up in a situation where they've not only got pain, but they really have restricted motion. The shoulder literally is stuck. Now, the reality of a frozen shoulder, though, is most of the time we don't have any idea why it happened. We call it an idiopathic process. In other words, we don't know where it came from or why somebody got it. So honestly, a frozen shoulder isn't something that necessarily comes from inactivity. So by and large, the unfortunate answer to the question is there's probably not a lot you can do to prevent a frozen shoulder. Because a lot of times it comes on without any warning or any specific thing happening beforehand.
Doctor, if anyone wants to reach you or your office, how can they do that?
Sure. Best way is to call the office, 443-849-3838, or you can also see us on the GBMC website, gbmc.org, and then /orthospc.
Dr. Todd Melegari, thanks a lot for your time.
Oh, thank you.
All right. And that's all from the CBS Up Close Performance Studio.